Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. And you're right, this is really not an ortho question. And this is an ortho channel, but I get questions all the time, so I'm just putting this out there. What happens if a tooth breaks? What do you do? Well, short answer is ask your dentist. So if your tooth, luckily nowadays, when most dentists have emergency lines, not just phone calls, but a lot of them have virtual ways to communicate through virtual synchronous or asynchronous consults. If you don't know what a virtual check-in or a virtual consult is, it's a way that you can basically chat with a dentist, show them what's going on, and see if you need to come in. Sometimes just showing, those of us who are dentists, we get these questions like every day from friends and family members and just random people on Facebook. Hey, what do you think this is? Dude, you need to go to your dentist. I'm not your dentist. But yeah, if you, let's say, for example, this tooth broke. Why did it break? Is the first question. That's the first question. When something breaks, why did it break? Was it trauma? Extrinsic trauma, like a ball, like an elbow to the face, you played basketball? Or is it intrinsic trauma, like your bite has a malocclusion? The way your bite comes together caused this to chip. Two different things. So you got to find out the cause first. If it's external trauma, there's no major problems, no cavity, no fractures. Then, we just patch it up and we're good to go, right? We fix it. If it's internal trauma, your bite caused this problem, or a decay caused loosening or weakening of the tooth, or a root canal or a gum problem caused the tooth to weaken, whatever. You've got to fix the internal problem first before, or the bite or the occlusion, or do some ortho, so that before you fix that tooth, okay? So that's the main thing I want you to figure out first. And that is something your dentist can help you figure out, or a lot of these emergency lines, in virtual ways can help you find that out too. From there, if you're in pain, the question is, well, why are you in pain? So we got to figure that out. First question is, are you in pain because of the jagged area of the tooth, or the trauma, or the blow of being hit? Or are you is it cutting up your mouth? Or are you in pain because this tooth is fractured and the nerve is sensitive? So we have to kind of look into that. Again, look at the bite, see what's going on. Obviously, if there's a jagged piece cutting open your mouth, you need to get to the dentist ASAP to get that taken a look at. If there was external force or trauma that caused it, you also want to get an x-ray to see if that tooth is traumatized, or see if the bone had broken. I can give you an example. I'll tell you a trauma story about a slightly broken tooth in my daughter. She's had two traumatic events, one falling off a bunk bed that ripped her frenum and caused some mobility in a tooth. At that time, we didn't do anything. But in hindsight, we're wondering if there might have been trauma in the bone, because she ended up with a massive bone defect. There also was trauma at age 5 where she got hit in the face with a doorknob, but that was a little further away from the bone defect. Now she's 16 and she has like massive bone defects in her mouth. So we're having to graft and stuff. We had an impacted tooth. We had another tooth that didn't form. We're assuming it's because of the trauma, but we never figured it out. So listen, trauma is no joke, especially if it's in a kid, because you don't really know what other damage was done under the bone. So make sure, you take a look at it. Make sure that you're getting the right, cold compresses. You're taking whatever you need to reduce swelling and discomfort. And the main thing is you just got to get into your dentist, right? You can rinse your mouth with some warm salt water. If there's bleeding, you need to control it. Ice is always a great thing. In terms of pain medications, talk to your dentist, see what's best. But usually, and also always save the old tooth fragments. If there's a fragment that came off, I would save it in milk in a container to keep it moist, but you need to get in within a few hours in order to have that rebonded properly. So that's pretty much it. That's what happens if you have a broken tooth. If the patient is actively in ortho treatment, you're going to want to pause the ortho treatment until we know that this is safe. I usually recommend pausing for at least a few weeks just to reevaluate it before continuing to move it, because really strange things can happen if you try to move a traumatized tooth. All right, thanks so much.